What is ataxia? Ataxia is a neurological condition characterized by a lack of voluntary coordination of muscle movements, leading to difficulties with balance, walking, speech, and fine motor tasks. It is not a disease itself, but a symptom of underlying disorders affecting the cerebellum, the part of the brain responsible for coordination or its connections. Types of ataxia. 1. Cerebellar ataxia, caused by damage to the cerebellum. Affects coordination, balance, and precise movements. 2. Sensory ataxia. Results from impaired sensory input, e.g., from peripheral nerves or the spinal cord. Leads to an inability to sense the position of the body in space. 3. Vestibular ataxia. Due to dysfunction of the inner ear or vestibular system. Causes imbalance, vertigo, and dizziness. 4. Hereditary ataxias. Caused by genetic mutations. Examples: Friedreich's ataxia, spinocerebellar ataxias. 5. Acquired ataxias. Result from injury, stroke, infection, alcohol abuse, or vitamin deficiencies. Symptoms of ataxia. The symptoms depend on the type and severity of the condition but may include 1. Motor symptoms. Poor coordination of hands, arms, and legs. Gait abnormalities, e.g., wide or unsteady walking. Difficulty with fine motor tasks, e.g., writing, buttoning. Tremors or jerky movements. 2. Speech and swallowing. Slurred speech, dysarthria. Difficulty swallowing, dysphagia. 3. Vision and eye movement. Nystagmus, involuntary eye movements. Difficulty with visual tracking. 4. Other symptoms. Dizziness or vertigo. Fatigue due to increased effort required for movement. Causes of ataxia. 1. Hereditary causes. Friedreich's ataxia. Autosomal recessive disorder affecting the nervous system and heart. Spinocerebellar ataxias, SCAs, a group of autosomal dominant genetic disorders. 2. Acquired causes. Trauma. Head injuries affecting the cerebellum. Stroke. Reduced blood supply to the cerebellum. Infections. Viral or bacterial infections, e.g., encephalitis, meningitis. Toxins, alcohol abuse, heavy metal poisoning, or drug toxicity. Vitamin deficiencies, particularly B1, thiamine, and B12 deficiencies. Multiple sclerosis, an autoimmune disorder that affects the central nervous system. Tumors, benign or malignant growths in the cerebellum. Paraneoplastic syndromes, autoimmune reactions associated with cancer. Diagnosis of ataxia. 1. Medical history and physical exam. Assess family history, symptoms, and potential triggers, e.g., alcohol use, infections. 2. Neurological examination. Tests for balance, coordination, and reflexes. 3. Imaging studies. MRI or CT scan to identify structural damage, tumors, or strokes in the cerebellum or related areas. 4. Blood tests. Check for infections, vitamin deficiencies, or autoimmune markers. 5. Genetic testing. To identify hereditary forms of ataxia. 6. Electromyography, EMG, and nerve conduction studies. Assess peripheral nerve function. Treatment of ataxia. The treatment depends on the underlying cause. While some forms of ataxia are treatable or reversible, others may require long-term management. 1. Treating the underlying cause. Infections, antibiotics or antiviral medications. Stroke, rehabilitation, and medications to prevent recurrence. Vitamin deficiency, supplements, e.g., thiamine, B12. Toxins, avoidance of toxic substances, and supportive care. Tumors, surgical removal, radiation, or chemotherapy. 2. Symptom management. Physical therapy. Improve balance, strength, and coordination. Speech therapy. Assist with communication and swallowing difficulties. Occupational therapy. Help adapt daily activities and use assistive devices. 3. Medications. For tremors, spasticity, or other associated symptoms. 4. Lifestyle modifications. Safety precautions to prevent falls, e.g., using walkers or canes. Adapting the home environment for ease of movement. 5. Supportive care. For progressive forms like Friedreich's ataxia, care focuses on maintaining quality of life through assistive devices and monitoring complications. Complications of ataxia: increased risk of falls and injuries, difficulty performing daily tasks, speech and swallowing issues leading to nutritional challenges, emotional and psychological impact, such as anxiety or depression. Prognosis and outlook. Reversible ataxia. Symptoms often improve when the underlying cause is treated. Progressive ataxia. In genetic or degenerative forms, symptoms worsen over time, but therapies can help manage the condition and maintain quality of life. Early diagnosis and a multidisciplinary approach can significantly improve outcomes for individuals with ataxia.